Our passion didn't start with the mouth. It started with people, with the well-being of the profession. And if you're like me, maybe a little bit of your nerdiness and all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on your tech, and listen to your gut while you take care of people and truly the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with the other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Welcome to the Dental Handoff. I am Dr. Kelly Tanner, your hostess. And guess who I have back today? Dr. Brett Sealove, the world famous cardiologist and the person carrying the torch for dentistry. He is the chief cardiologist and the Department of Medicine at Jersey Shore University Medical Center. Brett, thank you for coming back on the show.
Thank you for being crazy enough to invite me again.
Just so crazy right now. Today, in this section and session, we are talking about referrals and why they matter from a dental provider or any provider in that brain frame. So, Brett, tell us why referrals matter.
Yeah. Well, first and most importantly, I mean, they drive business and revenue. Although when you really look at some of the data of interest, the thing that really drives referrals is mostly on the patient side of it and not necessarily from the practitioner side of it, which is somewhat interesting. And I think that's a relatively new phenomenon the last 1 to 2 decades. It used to be, provider to provider. And now I think with social media, with Yelp, you're having the patient drive volume. But there's still a tremendous opportunity for all practitioners, dentists, medical practitioners, to obviously share in the opportunity of making sure that the right person is getting into the right hands, or in your world, the right dental chair. And that's really what drives a lot of my referral patterns, is that people that I am sending people to are people that I trust, that I like, I value, and I know what care they are getting when I send Mrs. Jones to that office. Mm-hmm. And it's a reflection on myself as well. But much more importantly, I just know that partnership and that collaboration coexists so well that the patient trusts me to make sure that I am handing them off to the right person for their specialty and their care. In the dental community, I refer people to a dentist. And in part, it's because of people who I know and trust in that world also. But again, the worlds are too separate. And I said this last time when I was on the show that, we're not driving, I don't think, a lot of the volume because this dentist, he or her, are so much better or knowledgeable, because we probably in medicine don't know who is more proficient in their care. Because again, what happens in the mouth stays in the mouth. That's how we sort of see this. And you let me know if you need me, but otherwise we're going to coexist in these 2 different parallel universes. So that's typically how referrals, start.
Yeah. And you brought up an interesting point, because when I'm thinking about referrals as a patient, from a patient perspective, I'm thinking that when I'm referred out, I'd never thought about it from a revenue stream aspect, but you're right. I just hadn't thought of, they want me to go over there so they can make more money. I'm just thinking, okay, this provider thinks that this is this important for me to go see someone else who is a specialist in this. And I had never considered that.
Yeah. I mean, listen, a lot of this is like everything in life. It really is trust. I trust my mechanic to do the right thing on my car, and hopefully they're not taking advantage of me. Mm-hmm. And patients have that trust and relationship with the dental community and the medical community. And, I really think you need to see this endocrinologist or this ophthalmologist. Why? Because you're a diabetic and high risk, and I really think you should see this person. And if it fits their insurance, listen, I trust Sealove, and I've known him for a decade, and that's who he recommends. And again, it's really important to make sure you understand. I am separating the world of finances, but that is one of the net benefits of the people that I'm sending people to, is that they are really good at their craft. And yes, they're going to have a financial incentive because you're going to get more volume from myself and my partners if you're able to step up to the plate and really, collaborate and have the outcomes we're looking for. And I see there's nothing different in the dental community.
Yeah, because so thinking back to like the root of the cause of why someone refers to you is because they, like in dentistry, we're seeing something that we know that's going to concern something else. We're making that connection from our sort of, I say myopic, but it's not really myopic. We're there with that captive audience, like you mentioned on our previous episode. We're there to say, hey, there's something more to this. And so not only is it dentistry who is saying that to you, there's other fields of medicine that are also referring to you for other conditions. Tell us more about that.
Yeah, that's a great point. So I would say on a daily basis, I get 5+ letters from other practitioners in other fields letting me know about what the patient is going through in their office space. So for example, I'll take ophthalmology for an example. And I get letters from ophthalmology all the time, is that what happens in the eye, it's the entryway into the soul of a patient. That's typically what people have said. And really more importantly, it's the entryway, forget they're into their soul. It's really the entryway to see the body without opening them up. The ophthalmologist has an opportunity that nobody has, including cardiology. You could see the blood vessels in the eye that reflects what's happening systemically. So an ophthalmologist will tell me, hey, wink, wink, sending you a letter. This person has diabetic retinopathy, hypertensive retinopathy, has a small ischemic stroke in a very small part of their arterial circulation in the eye. Wink, wink, that may have implications on what you should be doing. And again, that is one way that we collaborate and communicate. A rheumatologist, if someone has a bad autoimmune disease, even something like lupus, and their inflammatory markers are off the chart, we know that there is a systemic link for overall systemic inflammation and cardiovascular health, because cardiovascular disease is in essentially an inflammatory disease. And so we share these paradigms which do intersect. And we get conversations that happen all across the board from other medical specialties other than the dentist. And it, boggles my mind that if what happens in the mouth can be in some people this inflammatory periodontal disease that has a potential systemic link, that you'll do what you do, but I'm just not going to notify the medical community because it just never has. It's not how we do things. And it needs to start. This is how we do things. Let's mirror what happened in medicine over time, based on data, based on evidence, based on communication platforms, that, hey, I'm letting you know what's happening in the mouth has a potential link to how you're treating these patients. And these are our patients. Don't live in your own little silo,
right?
Dental world and medical world. We need to coexist. We're fighting the same fight. There's no reason why we should be doing this alone.
Absolutely. And then I'm thinking too, from our previous episode, you're talking about how cardiologists and some medical providers, they're not thinking about it. And I started thinking about how that referral actually triggers some type of correlation so if you get one referral from a dental office or ophthalmologist's office, you're thinking, okay, this is a one-off. But if you start to get more and more and more, it starts to make the case of, oh my gosh, why am I getting all of these all of a sudden? And then it brings it to your top of mind that there may be more than what you have learned about that you needed to learn more about and, continue your education on.
Totally agree with you. The other thing which is interesting is that it works both ways. So if I get letters from a dentist who he or she seems to be kind of informing me of something, again, non-judgmental, in a way of letting me know something, again, wow, this Tanner woman, I mean, seems to be pretty knowledgeable in this. And boy, I've learned a little bit about it from her. And I did it, I dug a little deeper on my own. And, listen, I have no skin in this game, which dentist you see. Maybe you should see this dentist who seems to be much more knowledgeable and communicative in this thing that we're trying to establish, which is your overall health. So I do think this work, these referrals will go back, back and forth. Again, none of this drives, the decision is not driven by the financial incentive from either party.
Right.
It's just in the way how busy all of us are. It's just in part, it's about trust and knowing that I am handing this patient off to you and I know what they're going to get in return. They're going to get great care, professionalism, and outcomes based on your skill set. And I think that's really, really important to know for your audience, but also just to know how the world spins. That's how this really works. That's how this collaboration works.
Yeah, it's the only way it works is through that. It's through collaborative care, because we cannot stay in our silos and we can't expect that one way is going to work if we only just give the information to the patient and we don't send it to you. And I think in a lot of ways, in some offices, just a click of a button, right, to make that referral over to you.
Yeah. The other thing which the other thing which is of interest, I've been in practice about 15 years. There was literally over the winter, I sat down at a medical conference in the hospital with an endocrinologist who doesn't come to the hospital very often. And I did not realize that endocrinologist was the woman who I've been sending patients to for like a dozen years. And she didn't realize that she was sitting next to me. We've never literally met. We speak all the time. But the point of is like in the way that we all now live and practice, and hospital-based or, dental, practices are different. It doesn't, it should be this personal connection, but it doesn't have to be. Like the point is like, it's just about trust and delivery of care. And it's okay. I've never literally met this endocrinologist up until this winter, because when I hand them off to this endocrinologist, I know exactly what they're getting. Patients love her. And more importantly, she communicates with me and her outcomes are impeccable. Why? Because she totally cares about delivering that care to the patient. And I know what they're getting. And again, I get nothing in return other than a collaboration.
Right.
And it's been a great partnership with this woman. And it just mirrors why there's no reason why this shouldn't begin in dentistry. I'm sure people listening to this may say, of course, that's how we do it in our community. There is this, we share patients all the time, these referral patterns, but I'm talking broadly across the country. I don't think that's really how it goes and how it works. And it should.
Yeah. So in dentistry, we refer to endodontists for root canals, or oral surgeons, or orthodontists, all the other dentists that are out there. And like you're saying, stepping back to have a referral source. And I know that speaking with many medical providers and some dental providers too, they'll have that person. Sometimes there's a person in our chair who hasn't had a physical, and we can notice the changes in their mouth from what we've seen 3 months ago, 4 months ago, 6 months ago, because it's in the mouth and you're going, whoa, you're a whole different patient today. Do you have a doctor who you're seeing on a regular basis? No, I don't. And so then you have this list of patients, providers who you can then refer your patients to as a provider for that original look and see, okay, what does your blood panel look like? What else is going on with you? So to have that list of people who you trust there and to know exactly what they're going to deliver on. And that's what we do in dentistry anyway, with ortho, endo, all those things. But think about it more broadly as to who's the endocrinologist or whoever, the general care practitioner. And then to your point, Brett, too, taking it even a step further on steroids. I don't know if that's a good saying and medical, but taking it even a step further, networking outside of your region and going to these national conferences to then make other interprofessional connections to say, you're who I've been referring to all these years. This is crazy. That's such an opportunity for us in medicine, because you never know how you spark an interest in someone else, because what you know and what they're obviously at that conference for a reason, because they're passionate, they're lifelong learners. They've taken the time and opportunity to learn more, and then to say, hey, you like that? I like that too. Is there some kind of shared message that we could deliver, and you and I can maybe be speaking at this conference next year.
Yeah, no, you're absolutely right. And there's no reason why that shouldn't happen. I mean, as a patient, as a recipient of dental care, my dentist has sent me patients. There's no reason why he needs to send me patients, other than the fact that he now knows who I am. He knows my personality. He's learned a little about me over the last, 15 or so years about, what I do for a living. And there is now this amazing collaboration from me and my dentist, the patients that we share. And it's sort of interesting, that I know my dentist very well. We share cell phones, so I could text him, hey, this person's A1C, their sugars are out of control. I have no idea what's happening in the mouth, but Mrs. Jones has voiced a little concern about both their sugars and her dental hygiene. Just let's stay in touch, kind of thing. So it's opened this door to these subspecialties for me over the last decade or so. But again, I want to try to get the dental community part of this conversation. They have a seat at the table. It's just kind of sitting afar in the corner because they've never really been invited to be a part of the active discussion. And again, that's in no disrespect from my friends and colleagues who are in the dental space, but it's just the reality. And conversely, me in medicine as a cardiologist, I'm not invited to your little round table in the dental world. I'm an outsider. And that needs to change. That needs to stop. And the dialogue needs to just begin. Again, you're going to have some naysayers, but I think it just needs to start to say, hey, listen, we are all sharing these patients and we all have a lot to learn from each other in order to make a dent in that patient's overall systemic health.
Such a profound point. And I'm thinking back to what you said about the ophthalmologist. I'm still just hung up on this part about how they can, you always know that you see them looking in your eyes. And I go because I know that I need contacts or need to update and my lenses, whatever. But they're just saying, I'm checking for this as they look in, better one, better two, better. And I'm like, can you go back? I have no idea the difference. But they're looking into my eye and they're like, everything looks great. I don't know unless they verbalize to me, I don't see any signs of diabetes. I don't see whatever. It's to the point, and it's also a parallel. Many people will think that they don't need to go to the eye doctor because their vision is just fine. And when in fact, it's the eye to the rest of the body, it's the field into the rest of the body, how they can screen for other conditions. And it's not very similar, but it's similar to dentistry where people say it doesn't hurt. And it's a similar thing as my eyesight is fine. I've never needed to go, but there's more to it than that. So it starts to create value and educate the patient to a different level of how they should value it as well with that messaging.
Yeah, I was going to say the same thing. Exactly right. I don't need to go see my dentist every 3 to 4 months or every 6 months, whatever it may be. My mouth is totally fine. I behave, I follow the rules, but oops, not necessarily. And there's a lot of things that are underneath the gum line that, a patient probably doesn't see or nor feel. But again, it also, because I'd like to hope I'm an informed consumer when I go to my eye doctor, and I have very low risks for retinopathy, but I ask the questions, right? So I'm empowered to ask the questions. And now that I know a little bit more about dentistry than I did, let's say 5 years ago, because I've kind of collaborated with the dental space a bit, I asked my dentist, hey, how's what happened to that probe? How is my gum line recession, inflammatory disease? I think that also part of this change in dialogue needs to start with the patient, right? So when I went to the dentist for years and years and years, they said exactly what your eye doctor told you, Kelly. Listen, everything's fine. Great. Vision's perfect. No problems. You walk out the door, you feel pretty good. I don't really know what that means. And when I leave the dental chair, I don't really know what that means. Everything is great. And it has been great, knock wood, but I don't know. So I asked them and they give a funny look. Again, I know my dentist pretty well. When I asked them about, hey, was there any probe? What was the probe depth? He gives me like, I have 4 heads. But I think it's important that patients are also going to be part of this.
Yes.
Patients are going to drive the conversation. As much as that seems scary to some, it's the reality. They're driving a lot of their care and the questions that they're asking me when they see me. And it's no different than what's going to happen in the dental world.
Well, I know that in dentistry, and I'm sure it's in medicine as well, that We have to give patients the information that we're saying. It gives them autonomy to make decisions. And if we're not doing that, it's against the code of our ethics. And that's why too, that when I'm coaching, when I'm teaching, it's always, as we are probing, we're calling out those numbers of 1, 2, 3, 3, 2, 4. We're not just sitting there doing it by ourselves. It's so the patient can hear and they're going, what are those numbers all about? Even after you take blood pressure reading or a pulse ox, your reading was blah, blah, blah. So it's more information to the patient. Okay, well, like I nudge the students to ask, what's normal for that patient? What does their cardiologist say that's normal for that patient? Because they're under the care of that cardiologist. You just heard them say that. They know their range because they're an informed consumer. Is this within their normal? Because they're going, oh, I don't know, it's elevated. They're this and they need it. I'm like, did you ask the question? And so it's that, and then the patient's going, yeah, that I know that that's normal for me, because all of a sudden the patient's going, well, that's fine. I'm fine. So all of that gives us more information.
Yeah. And I'll tell you, it really is. I mean, there is an adage of people say, listen, you, the patient, need to know your numbers, your blood pressure, your cholesterol, your sugar, etc. But even if you don't know your numbers and someone is telling you that your numbers are not normal, either in the mouth or in your bloodstream, bring that information to your healthcare team. It's okay not to know all these things. You're not supposed to know these things in the layperson. And I'm telling you, in the mouth, I don't know everything. Clearly, I don't know 90% of it. But if a dentist is telling me, I need you to be aware of this, you give this something to the patient, or the dentist is informing me electronically, or a communication, I am empowered to listen. Why? Because we are both fighting the same fight. Mm-hmm. And empower the patient to help deliver that message is also really important. And if you're screaming out numbers in the dental chair and I'm saying, I don't know what those numbers are, you say, listen, they're not totally normal. I want you to bring this information to your healthcare team that you have periodontal disease. Now, some of your healthcare team may not be knowledgeable enough to know what that is. I wasn't knowledgeable enough years ago to know what that means. I'd say, all right, well, thanks for letting me know. But then there's also this trust problem. If I don't know what that is, and a dentist thinks it's important that they're telling the patient to tell me what it is, then there's also the patients in the middle here saying, why doesn't Dr. Sealove know about this? Shouldn't he know about this? So it's important to bridge that divide by dramatically improving education. The dentist needs to educate the medical community. We are not knowledgeable enough, and we don't have the time to become knowledgeable enough. And it just takes a little nudge to just say, hey, this is important. There's a link between the oral cavity and your systemic health. And it's important for us to, collaborate and coexist. And we're all sharing in the same battle, and let's do this together.
So many patients will say, how do I even say this? But so many patients will tell us, no one's ever told us that before. No one's ever told me that before. I've been coming here for such amount of time and no one's ever told me that, because they're wondering, is this really true? Is this, the dentist always gets the bad rap of, does the dentist need a new car? I'm sure you've heard that. It's right. Because they're just trying to make sense of it. They're trying to be funny, but the fact is what I tell the patients, that your body isn't the same as it was 6 months ago, or a year ago, or even 3 months ago. There's cellular changeover that we have to stay on top of and to deliver that information to you. This has no benefit to me except for telling you what it is.
Yeah. I mean, complacency in medicine is just so common. If I've seen a provider for 15 years, everything is going fairly well, tweaking this, tweaking that, coaching me on nutrition and weight and exercise or dental care. And, everybody's doing okay here. To change this and to sit in another chair, like to your point, I was never told this before. And I get this all the time. I was really never told this before, that my EKG is not totally normal. You say, well, again, it's because the patient it's changed now. The patient now drives a lot of this care. It is really patient-centric. The world of medicine used to be very patronizing. It was me telling you what to do and now leave my office. And that whole thing has changed for the better. And to what you just mentioned, like, your body is changing on a cellular level. I mean, the other thing which has changed, I think, over the years is that this concept of, that as we get older, the risk of inflammation on your body and what it does to mental health, physical health is irrefutable. I mean, it's so many of the disease states, these chronic disease states which we battle, all are linked to systemic inflammation. And it's a bad, bad thing. And Advil is not the cure for it. I get patients all the time I check serological blood tests to see inflammation in their body, some of which are very specific for the heart. And they say, well, why don't I just, if it's inflammation, why don't I just take my 2 Advil, which I take for my knee pain? And I explain to them, it's just a total different paradigm. But you have one body, right? So if we're going to start talking about dental health and the oral systemic link, you got one shot at this. And if you had one car for your entire life, I would argue you're probably not going to drive it the same way you're driving your car right now. You would get that oil change on that mile tomorrow. You would keep that car crystal clean. And, you would treat it differently. Why in the world are we treating our bodies differently? And it starts from oral health down to your toes, right? I mean, so much of what we're doing is prevention. We really need to not reinvent the wheel. We need to coexist, co-collaborate, have the patient drive some of this. Again, make it patient-centric, and have the medical and dental communities, and again, fight the same fight for the right reason.
So profound. I love that analogy, Brett, if you had one car to drive for the rest of your life, it's so true. But I think so many times we think, oh, it'll be better because we've beat our bodies up. We put toxins in it. It's just like, oh, okay, I'll be better tomorrow. I know how my body will react to that, but why put the extra burden and stress on the body? It's just like with the car, it's designed to do certain things, but over time that's going to make the car, give out faster and degrade the car. That blew my mind. Thank you for that analogy.
You're welcome. The other thing, which I will just tell you, is that, the other problem with medicine and dentistry is some of which we live in is like instant gratification, right? If my tooth is killing me and I have a cavity, I need pain relief. If you're having a heart attack or something, or a stroke, I mean, it's immediate results. For chronic disease states, which drives 70 to 80% of healthcare, there's no instant gratification. And I would argue there's really no necessary detriment to my health if I don't know, eat a lot of candy and don't brush my teeth tonight, which I'm not going to do. Don't worry, Kelly. But because there's no immediate detriment to my health. Someone has a cigarette tomorrow and say, I'll quit tomorrow. That immediate problem is not going to affect somebody. And that mindset needs to change, that it really does affect you today, tomorrow, what you're eating, your physical health, what you're putting in your body, your dental hygiene today has an impact to you tomorrow, which has an impact to your future. It's not just, I'll just deal with it when I'm 60. Because when you're 60, that machine better be as oiled can get. Because there is a finite period of time here, and you really want to make sure as you get older, those risks are as minimal as possible.
Yes, and you're motivating me, Brett, to look at and evaluate my life now too, and say I'm gonna choose that salad every single time. No, that's not what you're saying, but to look at our daily actions, how they compound on the overall projection of your health when you're older. And it's like taking a multivitamin. You can't measure the fact that it's doing something better for you. You just hope that it's doing. And it's like fluoride use. It's like exercise. Well, with exercise, you kind of after you finally get to the gym, you feel better. And after you do it, you're like, okay, that wasn't as bad as I thought it was. But those daily decisions that we make, those tiny decisions actually lead to a larger health benefit and outcome that we can't measure directly.
Absolutely. But I mean, it's no different than flossing. Again, I floss every day for 20, 30 years. I didn't start until I was a little late in life. I'm sorry.
It's okay. It's okay.
But the reality is like, there's no instant gratification, but it's also patterned, right? I know it's like literally like brushing my teeth, putting in my contact lenses in. I mean, it's part of my daily routine. So if we get our patients into more of these patterns. Even if it's no instant gratification, I know it's going to continue because it's this pattern that started. And that's the reason actually why my kids, my patients, my friends, you start these patterns early. You don't want to start a pattern of dental hygiene, when you're 55 and say, boy, you want to start it when you're 15, if not younger.
Right.
So, and it has to do with this whole overall, again, your overall view of health. But I do think that our worlds are a little bit more similar and they are different. And you highlighted some of that before. And there's no reason why we shouldn't continue to pave the way for the future for all of us to improve our patients' lives together.
So well stated. Brett, you're just your gem. And anybody who wants more of Brett, there's information of how to contact him in our show notes. Thank you so much for all that you're doing to serve our communities and carrying the torch and all the things that I said previously. But I look forward to collaborating with you and educating, right? Just taking this forward and educating our community. And so thank you for being on again with us today for episode 2.
The pleasure is mine. Kelly, thank you so much for the opportunity.
Yes. And for our listeners, thank you so much for all that you are doing in our communities. And if you wouldn't mind, like I always ask, to give us a 5-star rating on Apple Podcast, and then also on YouTube, like, subscribe, and share with your friends. Thank you all. Have a great day. Keep doing great things.